Okay, maybe we'll start with introductions then. I think we're up to 57 people on the call, which is a good number. For those of you who I haven't met, my name is Bonnie Lewis. I'm a principal analyst in I'm in health team here in ONS, working as a workstream lead on our SOSCHI project, which I'm sure a lot of you have heard about, but Virendra will also be presenting a bit more about the project. So the title of our webinar today is Improving Official Statistics in Climate and Health, focusing on data challenges, solutions and policy perspectives. Before I start with the introduction of our speakers, just to run you through some housekeeping, I'll ask Virendra to share that slide very quickly. So for the webinar will be held in English. However, there is the option for live subtitles in selected other languages. And there's some instructions on the screen there for anyone who'd like to follow using those subtitles. So click the More button in the top menu and then select language and speech and turn on the live captions. There is the gear icon settings on the caption window where you can choose your preferred language. We also, you'll notice that I think the chat is disabled, but we do have time at the end of the session for a live Q&A session with our speakers. So do use the code 9380 at slido.com, or there's also a QR code on the bottom right of the screen that you can take. You could link you directly to the Slido. Also, just to inform you that this session will be recorded. We'll be producing a transcript of the webinar, and by joining the session, you're consenting to being included in the recording and the transcript. If you have any concerns about this, please contact us. So that's everything in terms of housekeeping. Just very briefly on the agenda then. Shortly, I'll hand over to my colleague Virendra Ngola, who will be presenting on the SOSCHI project. We then got Professor Tariq Ben Mahania from the University of California, San Diego, joining us today in person in the Newport office. So great to have him here. He's been a topic expert on this project and working specifically with us on the wildfire topic. And he'll be presenting on data challenges in climate and health statistics and how to address them. And then we've also got Dr. Kanza Ahmed, who's the head of global disasters at the UK Health Security Agency. The UK HSA are one of the project partners on the SOSCHI project. So great to have her also presenting today on the policy perspectives of this climate and health work. And then, as you can see, we've got about 10 minutes at the end of the session for Q&A. A reminder again for you to please use the Slido to ask your questions. Okay, so I'll hand over to Virendra then. Thank you, everyone.
Yeah, thank you, Bonnie, and thank you, everyone, for joining. Welcome. And before I start to introduction of the SOSCHI, just wanted to acknowledge and thanks to our team. So on behalf of SOSCHI team, and those institute who is leading this work is acknowledged here, closely working with African Institute of Mathematical Science, the Cochrane Planetary Health, and other key governments and other UN agencies with whom we work closely. We also acknowledge to welcome for their funding. Also here not listed, but we work with the expert advisory group members, mostly the academic field, and also the topic expert group across the globe is supporting and helping to develop the SOSCHI framework and methodological approach. So the SOSCHI stands for those who are joining the first time. This is the Standard for Official Statistics on Climate and Health Interaction. This initiative is funded by Wellcome and led by the ONS team. And we are currently at the end of the project, and the main objective for this project is to develop the global standardized framework with unified method for official reporting of climate impact on health, both at the national and subnational level. But also in order to disseminate and giving access to the framework and the methodological approach, we also developed the online platform where we are sharing all our methodological framework and open source data toolset. So this is the main aims for this initiative. And the problem we are trying to solve or we are trying to address is there are many different statistical approaches available and complex methodology, but despite of this extensive usage of or availability of this method, but there is no standard or harmonized tool which can be helpful for countries to officially produce the statistics on climate and health interaction. Finally, also these resources and methodological approaches mainly applied in high-income countries, but also we wanted to give these resources to open for a wide range of users and countries, particularly looking at the low and middle income countries where we can share these resources. So what is this SOSCHI framework and indicator and how we have developed this? So there are different methodological approaches and development process for defining these indicator, defining these methods, from identification of the topic or selection of the topic up to the publication of those methodological approaches and also sharing the open source tool. So we have engaged with a range of global experts, both nationally and internationally. The AIMS team, the Ghana team and ONS team has also developed the methodology and standard approaches. We also tested and refined in other geography beyond these countries to get the feedback, the improvements, and its generalizability before we finalizing, before we publishing and disseminating the framework. So there is no single statistics which can measure the climate impact on health. So based on our primary research, but also the recommendation from WHO, IPCC, and also the country needs, user needs, we have defined these 10 topics under the SOSCHI framework has been developed. Those which are in green color, which are fully developed SOSCHI framework topics, and those which are in red color, the alpha version has been developed, but the full methodological and open source tool has not been fully developed. But the preliminary research and methodology has been developed and shared. There are many initiatives, but these are the main benefit of SOSCHI framework benefits, because our target and our main objective is to support the operationalization of high-level indicator into specific and feasible subtopic. And also this methodological approach also enable the attribution of health outcome to climatic factors. So here to caveat that this is only the climatic factors rather than anthropogenic climatic changes, as the attribution method still is in development. And also the additional benefit for SOSCHI is we are giving the methodological guidance, the open source R code and online tool for the implementation for countries to implement. And just one example for implementation through our platform. So the platform is already developed. The final version yet to publish by the end of June, where we have the deadline for publication of this platform. But the platform gives the current state of knowledge through the topic introduction, the methodological documentation and metadata sheets. Also some of the preliminary work on the discovery and alpha phase report where we identify the user needs. We recently also published the open source climate and health package. We do have the open source GitHub code, the analysis tool. All these resources are available for country to implement and operationalize the climate and health. This is just an example for the recently published climate and health package, where we have given the 6 priority indicator tool and their methodological tool for a wider community to implement. We recently also got the global alignments and UN endorsements on those priority indicators as well, but I will not go into detail. And also, as mentioned, there are many initiatives. So we are working with all those global initiatives very closely and trying to align and how to feed rather than creating something new work to feed into the UN global state of climate change statistics and indicator. And these are some of the specific indicators and methodological approaches we incorporated and recommended to the UN Statistic Commission, and where there has been endorsed. So with specific to indicator on the incidences of cases to climate-related diseases, the heat and cold-related illnesses and excess mortality, and climate-induced air pollution. And our expert will talk more on the methodological approaches and data challenges and solution from that perspective. So thank you again for this opportunity. And now I'll hand over to Professor Tariq. Before going, we also have some upcoming publication, but I will talk more details on the later. Just to concluding, we are in the final few months of the project, and now we are focusing more on the implementation after the phase, finishing of this phase, and then our continuing engagement with the UN and WHO and other partners as well. I'll hand over to Tariq then, and we'll come back to the Q&A if there is any questions.
Okay, so I don't know where to look at. So thank you so much, and for your invitation for organizing this event today. And just make sure, so I have 15-20 minutes. Right?
20.
Yeah. Make sure I sound. So I can accept. So I'm very happy to be here. I today wanted to talk about a specific angle about just like why evidence and data is a key environmental justice issue, and I want to put that into a more general framework. I will use a few examples to illustrate why this is critical and super important, and then I will propose and I will discuss about a few kind of existing solution and future solution that I think could be interesting to explore. So this is like the outline, the menu for today. So at the end, I will just give you a very brief introduction to what we call nowadays transportability methods, which I think are very, very promising to deal with this kind of inequality in climate and health evidence between high-income countries and low and middle-income countries. And I will show an example, a methodological example, like demonstration in California, just to show how we can implement and adapt these methods to time series data in relation to wildfire and respiratory health, but I also use a large example already in relation to temperature. So first of all, just like to make sure everybody is just like on the same page. So one, I like just like presenting the connections between climate change and human health in this way, because when you think about the context, the connections between climate change, climate variability, and human health, population health, I think we can summarize everything with these three types of categories, where we see climate change as the context in which climate change is going to exacerbate existing environmental and weather determinants of health, like extreme heat, for example. Without anthropogenic climate change, we would have extreme heat events. But in the context of anthropogenic climate change, we just see more of them. We see that these events are more intense, they are more frequent, etc., etc. So this is the first mechanism through which climate change and environmentality can be connected to population health. The second mechanism through which climate change and population health can be connected is through like the duration of creation of unprecedented situation. So an example about temperature is, for example, we can be that's the case in many coastal areas, like in California. This is what we see. Extreme heat has been traditionally a dry heat problem, a daytime problem. In the context of climate change, we see more and more nighttime driven and humidity driven heat events, and that is directly attributable and linkable to climate change, anthropogenic by increasing atmospheric moisture. So this is the second mechanism. Another example is vector-borne diseases. There are many regions in which, without anthropogenic climate change, we would not see endemic vector-borne diseases such as dengue, malaria, etc. But finally, climate change in relation to population health, it's also an opportunity to think about how we can have a lot of health benefits in relation to mitigation policies that we can define as any action that will aim at reducing emissions and concentrations of greenhouse gases. So when you think about reducing emissions from the transport sector, there will be a lot of co-benefits through promoting physical activity, active mobility, reduction of air pollution, etc. But also diet is another good example. When we try to promote the reduction of red meat consumption, there are a lot of health benefits associated with it. So this is like, to me, how we can think very comprehensively about the connections between climate change and population health. So climate change is just a context when you think about it. Climate change is the context that will impact population health through these three mechanisms. But besides that, something that is important is also to think about climate change as an environmental justice issue. And to explain that, so I'm not going to get into the data because I would like to focus on one component, one specific level of environmental justice. But usually we consider that climate change is an environmental justice issue. First, because there is a big discrepancy between contribution in terms of greenhouse gases historically and where impacts attributable to climate change, anthropogenic climate change, are located nowadays. And that pattern works globally between the countries that contributed the least in the past century and where most of the climate hazards are taking place nowadays. There is a perfect inverse correlation. We analyze that. But the same applies within a city. I don't know too much about the UK data, but in North America, there is a lot of evidence showing that, for example, there is a perfect inverse correlation between historical emissions of greenhouse gases and the density of microgrid islands. So there are evidence in LA, Toronto. So this differential contribution impacts happens at different scales. So that's the first component of how climate change is an environmental justice issue. The second one is differential exposure. So we typically talk about the triple jeopardy in environmental justice: differential exposure, differential susceptibility, and differential adaptive capacity. So differential exposure is when some subgroups defined as marginalized in the US, it will be mostly driven by socioeconomic, socio-demographic factor and structural racism kind of proxies like race, ethnicity. And when some subgroups, some communities are going to be systematically more exposed to air pollution, systematically exposed to higher density of microgrid island, less green spaces, etc., this is differential exposure. But in parallel, and it's not mutually exclusive, even where communities are exposed to the same level of air pollution, PM2.5, for example, the impact, the health effect is going to be disproportionate among some subgroups because of the pre-existing conditions or pre-existing other social determinants of health, like pre-existing comorbidities, lack of access to healthcare, occupational status, etc. And finally, even when we implement different types of actions, resources like different policies like access to cooling centers, etc., these resources are usually also differentially accessible to communities. And again, this is always the same pattern that is not random. And this is what we mean by the triple jeopardy in environmental justice. But another dimension that I would like to emphasize today is climate change is also an environmental justice issue because of the differential evidence, and particularly epidemiological evidence. And this is what I would like to just illustrate and explain why it's important. So this is an example from a study we did a few years ago, highlighting just like the evidence, epidemiological evidence about extreme heat and health and type of health outcome in low and middle income countries. So first of all, you can see that in, for example, sub-Saharan Africa, there is like very, very few countries in which, at the time of this study, which was in 2019, I think, like just evidence was just available. And then except maybe mainland China, there is just like there are many, many, many countries for which there are one or two studies that have been conducted. And that's a big problem. One statistic that we use in a discussion of the paper is to say that there are more studies in a single city of Phoenix in Arizona in the US than in the entire continent of Africa. And that tells a lot about just like the lack of information and evidence that is a premise for any type of advocacy and then action. And for temperature, you will see that this is even more important because like what we know about temperature and a given health outcome in a given context basically doesn't tell us anything about what's going to happen in a different context. And that's very true for temperature. But the same applies to wildfire. This is also like a comparison we did a few years ago, just to show on the top, this is where most wildfires are taking place, averaging like 1997 emissions to 2015, but just like to illustrate a little bit the specific point. And you can see that, of course, there are some fires in Australia, some fires in Latin America, in Brazil, in California, in Canada, but you can see that the like regions in which most of the wildfires are taking place are in sub-Saharan Africa, specifically in Angola, for example. And at the bottom, you can see where epidemiological evidence is available. And again, this is not a random pattern, and that's a big problem because we generate and we have evidence in context in which it's not, wildfire is not systematic, it's the most problematic issue, and that's a big problem. So this is really what I wanted to emphasize, but with some solutions too, about how we can start addressing this type of issue. So first, I want to use temperature and health and mortality just as a motivating example to explain why we really need localized data and why it's not because we have information from one context, one country, one city, one neighborhood that we can interpolate, extrapolate everything to another context, and that's very important. So very quickly, when you think about extreme heat and health in general, it's very important to distinguish what we call the direct impacts from the indirect impact, because of course, it's like there will be some, for example, if we focus on mortality, there will be some death that will be directly attributable to extreme heat, so heat stroke. So there is a specific ICD code, like from the International Classification of Disease 992, which is specific to heat stroke and heat complication, heat-related illnesses and complications. But that's only the tip of the iceberg, because many deaths that would be attributable to heat, meaning that they would not have happened if like extreme heat was not happening, or if there are a lot of very effective policies in place, are going to happen because of an exacerbation of existing preconditions, particularly cardiovascular diseases, cardiometabolic conditions, etc., and are very hard to document. So this is why we need complex epidemiological models to try to capture that. And this is what has been presented before, and this effort is very important to try to get that, because otherwise it's very hard to have a clue. So we'll skip that. But this is, to me, I wanted to show this study just to kind of acknowledge effort, but also to recognize that sometimes effort is not enough, because here this is an effort from the global burden of disease team. So they tried to estimate the global burden of extreme heat. And in some countries, for example, the US, when you compare the estimates from the US, when you compare the estimates from the US, like about 10,000 deaths, when you compare to actually like robust estimates conducted in the US with real epidemiological data, it's not that far, because the numbers in the US is like vary between 12 and 15,000 deaths attributable to extreme heat every year. So it's not totally off, because there is a lot of data. But then what they do in this effort, they do a lot of extrapolation, and they work on a lot of assumptions, and sometimes it doesn't work. And I just wanted to point the example of New Zealand or Chile, where basically they estimated by extrapolating estimate from other countries, that basically like there is like 2 people dying because of extreme heat by year in the entire country, which obviously doesn't make any sense. And same in Chile. And there are a lot of studies conducted in Chile, for example, that totally contradict that by multiple orders of magnitude. But this is just to show the limitations of these extrapolation efforts. And when we don't have data, you can't make miracles. So this is also why we really need to come up with solutions, generate local evidence, because we can't work with existing tools. And even if they tried, I don't think we can call that a success. So here, this is just an example from a very influential, important study from more than 10 years ago now, showing the dose-response relationship between temperature and mortality in multiple cities. And here, what I would like to emphasize is how the dose response, shape of the relationship, but also the temperature after which we start seeing an increase is totally different between cities. And here, this is just to highlight that we can't extrapolate. We really need to understand what's happening city by city. And here, even within a city, I took San Diego as an example. This is where I spend a lot of my time. And San Diego is a coastal city, and we typically have 3 types of climate zones. We have the coastal region, we have the inland region, and we have the desert region. And here, this is the same city, the same county, and we can see on the right the dose response between temperatures in Fahrenheit and the risk of hospital admissions for heat-related illnesses causes. And you can see that just within the same city, the threshold varies by 25 degrees in Fahrenheit within the same city. So just to say that we really need a lot of local evidence, a lot of local information, and without that, it's very hard to guess and understand what is happening in relation to heat and different types of health outcomes. And again, this is just, for example, this study is just about mortality, but there is a lot of heterogeneity between the causes of death, but also just like different types of health issues like pregnancy outcomes, etc., and mental health related outcomes, etc., etc. So that being said, there are different possibilities because, of course, all of these studies are built on this premise that we need to model daily fluctuation between temperature, whatever temperature metric we're talking about, and mortality or hospital admission, so at the daily level. But there are alternative questions and alternative kind of resolutions or scale at temporally and spatially that will be, even if not as good as what we can do with daily data, will be quite informative and useful. And there is these two studies that I wanted to highlight by some colleagues from Barcelona. They just like did some kind of exercise to try to see how we can extrapolate the daily dose response between temperature and mortality to weekly and monthly dose response relationship. And of course, not surprisingly, they found that going from daily to weekly, if we make specific assumptions, it's not that off. But as like we go from daily to monthly, like the discrepancy between what they consider to be the truth, which was the simulated data, and what they estimated was off. So there are like some kind of techniques under specific identification assumption and analytical assumption that could work, but just like daily to weekly is basically like a good compromise, but beyond that is basically not working very well. So this is the conclusion from these two studies. But another solution is also to think about a different type of temporal scale. And when daily data, especially for mortality or the health outcome of interest, is not available, it's also possible to think and focus on different alternative etiological periods. And monthly or quarterly periods can also be interesting. It's a slightly different type of question, etiologically speaking, but could be interesting. And in this context, existing tools are available. And one of them is called two-way fixed effect, which is used a lot in some disciplines, like in demography, in econometrics, and this is something that is started to be used in epidemiology quite recently. And that approach offers a lot of advantages, and this is actually something that we highlighted in this recent paper. I'm happy to talk more, but I don't have time to go through it. But here we just explain how we can use this type of two-way fixed effect model to study weekly, monthly, and quarterly etiological questions, and we also proposed like a reproducible framework to actually select a combination of fixed effect and the interaction. So, and also we have published all of the code. If you want to replicate that, we use that in any of your work. It's available, enjoy. But that is, so just to say that if we can't rely on daily time resolution, we can also try to adapt to the research question and existing tools. And I think this is better to generate tools at a different temporal scale than having nothing at all to try to guess, as the global burden of disease effort was attempting. So now, just in the last 4 minutes, I would just like to introduce you to some kind of very recent methodological developments in data science and applied to epidemiology. And this is in the context of what we call transportability methods. Transportability or generalizability, I will define that in a minute. And just to show the premise of that. This is very, very new. Most of the publications about this topic are from the last 2 or 3 years. So that's very, very new, but I want to show that it may constitute a promising avenue. So some definitions first. So when we're interested, this is a case for any type of quantitative social science, including epidemiology. We distinguish internal from external validity. So internal validity is really about systematic error or bias. Could be confounding bias, could be selection bias, could be misclassification bias. So this is really what we mean when we talk about internal validity. But it's very important when you try to ask a question in epidemiology, for example, to also make sure we define a target population. When we address a causal question, what is the target population? What is a population for which we want to make the difference, for which we want to use these results? And that's Most of the time it's not, it's implicit, it's not defined. And I think it's always a good idea to be very explicit about that. And so then, when you have this kind of issue of external validity, which can be defined vertically from the study population to the target population, for example, we do a study in Newport, we can define the target population as all of the UK population, or it can be the Newport population. It depends, but it depends like to whom we want to make the inference for. So that would be what we call generalizability from the study population to the target population. But then if we have two different study populations that may or may not have the same target population, we can also try to understand what makes them different. And this is what we call transportability. So generalizability is like vertical external validity, while transportability is more horizontal external validity. And that is what I'm going to talk about. So, and this is a very active area of research. In data science, in epidemiology, and other fields. And this is just to show a few examples, but I would like to wrap up by showing a case study just to demonstrate that it's promising and it can work very well. This is a selected example because it works pretty well, but this is just to kind of be optimistic. So here, this is just to show how we can apply these transportability methods that are based on different algorithms, and I will just show one which is based on what we call superlearners, which is just a combination of different types of machine learning algorithms applied to time series modeling. And how we can use that to basically understand, like when we have incomplete information from like population B, but we have all of the information on population A, how we can understand this discrepancy and predict what is going to happen on population B with incomplete information. And I will show you that when it can work pretty well. So here, this is a setting. This is California. This is in 2018, the Camp Fire that happened for like more or less 2 weeks and impacted 25 counties. So here what we did on the left, we considered each county separately. So we estimated for each county the effect estimate, the increased risk for respiratory hospitalization attributable to this smoke event. Okay, and you can see that you have a lot of variability across county. And here what we want you to do, we know the truth, so that's the truth for San Joaquin. We estimated we have all of the data, but we said, let's hide this information. Let's say we have no information about respiratory hospital admission in San Joaquin, and let's try to see if we can retrieve it using information from other counties that were exposed to this event, etc., using this type of combination of machine learning algorithms, like via a superlearner. And here, this is what we found very briefly. So here, like you can see that the red is the truth. So this is what we actually observed. This is what we estimated with all of the data. And here, in green, this is just using a simple logistic regression. And in blue, this is using a superlearner, so a more like kind of flexible approach. And first of all, we see that using a very flexible approach in this context doesn't necessarily do better than simple logistic regression, which is quite consistent with a lot of the machine learning algorithms. We show that actually most of the time it's not particularly helpful. But here you can see that when we use randomly other counties from wherever, we see that there are like a lot of variability in the performance of this kind of prediction as compared to the truth. But below is actually, we show that we can actually get very, very, very close estimates, whether we use a logistic regression combined with interpreted time series analysis, or whether we use a superlearner. And this is when we use like the counties that were as close as possible to San Joaquin that were also associated with an increase in hospital admissions. So here, this is just to show that depending on how like the information we're going to use to try to predict what is going to happen in this context to San Joaquin, if we use like counties that are relatively close in space, but also in terms of population composition, we can actually get the truth. And that's, to me, very promising. And we expanded this work to different applications in relation to temperature as well. And we found very comparable results. We just show that we can actually do a lot, even with incomplete data. And here we hide, we omitted all of the health outcome data in San Joaquin. And I think this is promising. So this is what I wanted to wrap up with. So in summary, I just wanted to emphasize how epidemiological evidence is a total environmental justice issue, and we really need it. Without that, we just can't guess. And when we try to guess, it can go very wrong, as I showed. But there are a lot of solutions, either by switching a little bit the study question and adapting the scale, or using these innovative and emerging methods. So this is just like what I wanted to comment today. And we say thank you.
Thank you. Thanks so much. I'm going to hand over to Dr. Kamza Ahmed to take us through the policy perspectives. I think we're about 8 minutes behind schedule, but I know, Kamza, you were intending for your session to be a little bit shorter. If we can try and leave 10 minutes at the end for Q&A. For anyone who joined after we did the introduction, we do have a separate Slido. The code is 9380. So please do log on to Slido and add your questions. And I think the General will share his screen with the QR code while Kamza does her presentation. Thank you very much. I'll hand over to Kamza now. Thanks.
Thanks, Bonnie, and hi, everyone. I'm Kamza Ahmed. I head up the Global Disasters, Climate and Health function at the UK Health Security Agency, but I'm also co-chair of the UN's Interagency Expert Group on Disaster-Related Statistics. And so we're going to cover a few things. Now, I've not got any slides, not because I'm an expert public speaker, but more because I have a brand new laptop today, and it was too risky to try and do slides. So what I want to do in this session is actually just take you on a journey, right? Strap yourselves in, because we're going to start off internationally and then we're going to end at your street in your house. Okay, so why are we interested from a policy perspective about, climate and health statistics? Why is it important? Well, we need consistent and robust climate and health statistics. Billions of pounds are being invested in adaptation on a yearly basis. But how do we know that they're having an impact? How do we know that it's value for money and that money is being used well? And how certain are we of what proportion of hazards are resulting in actual climate change impacts? Give you an example, there was one country that we were working with who were adamant that their climate change impacts that they were seeing, were quite obvious, and that they were absolutely adamant that there was a direct correlation between the change in the weather and the increase in malaria cases. And as we began to unpick the statistics and the data, what we discovered was that actually housing policy in that country had changed recently. And so people were able to build their houses on wetlands, therefore increasing their exposure to mosquitoes, rather than actually it being a climate change related event. So it's really important to have that accuracy as well when we're looking at the statistics. And so making sure that the statistics are robust, they're consistent, they're standardized, and the methodologies as well, how we get to that information is important, because in a lot of countries that data isn't available. So what are the proxies? How are we actually going to make sure that data still stands? So standardized approaches are really helpful to us in the policy side, because it helps us to understand how much we should be funding, because ultimately money does play a big driver in all of this. So how much should we be funding in risk reduction activity, but also how much should we be putting aside to respond to disasters? Whilst we might do risk reduction, we can never avoid all disasters, right? Disasters will still happen, things will still need to be improved, and we still need to build back better. So actually knowing how much countries need to put aside is really important. But also, taking the previous presentation, Professor Tariq, better understanding of the different levels of injustice and provide a sound evidence base for policymakers to be acting as well. So I talked earlier that, I mentioned earlier that I was chair of the Interagency Expert Group on Disaster-Related Statistics. And as part of that, we delivered the Global Disaster-Related Statistics Framework, which was endorsed by the UN Statistical Commission in New York in March 2026. So actually the same week in which the SOSCHI indicators were also endorsed. For those of you who haven't come across the Global Disaster-Related Statistics Framework, it's the result of a multi-year collaborative effort. It's involved subject matter experts from national statistical offices, national disaster management offices, international and regional organisations, as well as other key technical stakeholders. It's a very, very comprehensive approach we've taken. And it's the first ever global framework on disaster-related statistics, which also covers disasters that are linked to climate change. And the framework provides what we feel is an internationally reviewed, statistically sound and coherent foundation for measuring hazardous events and disasters. It also includes their impacts, risks and disaster risk reduction activities and expenditures as well across social, economic and environmental domains. So really it covers the whole aspect and not just sort of, a slight element of it. And that's really important from the public health perspective, because actually for us, the climate and health is one element, but actually all the social factors that determine climate and health also need to be counted and thought about as well. So when we developed the framework, we decided to go through a global consultation last year, and it was really important that we had that feedback to know where it's going to be workable. So we had national statistical officers, disaster management agencies, diverse group of academia, researchers, experts. All of them responded with, really strong support for the framework and recommended its endorsement. So what we then did was we took it to the UN Statistical Commission in March. We explained what we'd done in the process, and we asked them to endorse it. And what the endorsement has enabled us to have is an agreement that we're going to use a methodologically sound and internationally set of guidelines for strengthening disaster data production. And it's also going to helpfully, over time, improve the statistical capacity for disaster risk reduction, because it gives particularly national statistical officers a sort of a framework and guidance that says to the policymakers, hey, if you want to understand what the impact of disasters are, you need to invest better in the statistical bit. And here is the framework that says how we should do this, right? And actually, what it also does is it provides the evidence base for monitoring the Sendai framework for disaster risk reduction. And actually, it helps countries in formulating the resilience plans and strategies. So again, do you know that your strategy is having an impact? Well, if you have good data and good statistics, you will know that. And you combine that with the SOSCHI indicators that Vijendra talked about earlier, and the links to the global goal and adaptation. What we then have is this triad of actually better understanding of the true burden of climate change and disasters on health. So it's really, really important to have those principles and frameworks in place. So that's the international level, right? I want to bring you a bit more local now. So we're starting to come home. So at the local level, with statistically sound data, we can actually better inform government level committees. We can have better, realistic and measurable policies on climate and health within countries. The Sendai Framework for Disaster Risk Reduction, so we're talking about the UK now. The way that we have approached this is that actually we have an implementation group across the UK, and that combines, brings together different government agencies who actually feed into the elements of disasters and statistical elements. And what we're doing is we're using that global disaster-based statistics framework to help us to implement the way we actually deliver our statistics and understanding of what the impacts are. Now, bringing it a bit more closer to home for me, the UK Health Security Agency, we're working to develop a series of metrics to understand the impact of climate change on public health on the nation, right? And this is with England. So whilst we are the UK Health Security Agency, technically we only cover England. And we are working closely with our colleagues in Scotland, Wales and Northern Ireland to look at what these processes look like, and also engaging with colleagues in the Office for National Statistics. As part of this process, we're trying to collate what the statistics are internationally and looking at how we apply that to a local level. Now, here's the important thing. For a lot of people, climate change is a really abstract international thing that's discussed in these big international meetings that I've just talked about. But actually, what does it mean to people? So what we did was, following COP30 last year, we did what we called a translation project. And what that did was to bring together all the recommendations that came out of COP and translating them into local level action for local government. So actually, how can local government contribute to the COP recommendations, but how can the COP recommendations influence local government activity as well? And that was really important because it's the first time anybody's ever done that. And actually it starts to bring what the reality of climate and health and climate change and all of those statistics are at that local level. And it goes back to, the presentation we just saw, are actually understanding what's happening at that local level, breaking it down to the counties and to the town level so we understand what is actually happening. There's been a whole load of movement in the last 4 years in terms of the climate and health, statistics and disaster spaces, right? And I have seen so much change over the last 4 years. But as always, I'm never satisfied and there's always still more to do. And if you were to ask me what's on my wish list and what I want to see happen, what I want to see is the way we talk about statistics evolving so we can interpret it at that local level for the public. Right, to help the public to understand what these statistics mean and what they can do about it. And it closes that feedback loop of actually, we've got these statistics from local data. This is what the picture is. This is how it informs policy. And this is how individuals see the change for them or feel that they can contribute to a change. Right. And actually, by doing that, what it does is actually enables people to feel like climate change is not an abstract concept, that actually everybody has health, right? Everybody, whether it's good or bad, everybody has health. but actually climate change impacts it in different ways. And some people don't even realize it's happening. Some people do know it's happening, but don't know what to do. And other people know that it's happening and know what to do. And actually, by translating those statistics into a manageable, easy to understand way, people can talk about actually, oh, this is how I contribute. So, today my recycling bin is being collected. This is how I'm contributing. And this is the difference I have personally made, right? So I said to you, we'd come down to your street level. If you were to knock on your neighbour's door today and ask them, do you understand what climate and health statistics are showing? What would they tell you? The answer is they probably won't be able to tell you much. And I often talk about, we've got Mr. and Mrs. Smith in Milton Keynes, which is a new town within England, right? They live in their house. They've got 2 children and a dog, right? They go to work. What does climate and health mean to them? What do these statistics that we publish mean to them? And what can they do about it? And for those who've worked with me quite closely, and I know colleagues in ONS are probably fed up of me saying this, I'd often say, so what? You produce these statistics, so what? What difference is it going to make, and what change are you going to bring? So here is where I'm going to sort of bring it to a close and say there's a call to action for every single one of us on this call and beyond, right? There are things that we can do when it comes to the statistics field, right? Number one, I urge you to implement the Global Disaster Related Statistics Framework. Really important that you bring those guiding principles into your work so that we have statistically valid approaches and we have a standardized approach, right? But also the SOSCHI indicators, and engage with the platform. The SOSCHI platform was built by us, for us, as in us, the community, right? We are here, it's only as good as how much we use it and what we put into it. So it's really important that we engage with it, right? For those of you who like to be a bit more interactive and in person, I'd like to encourage you to register for the UN's 6th Expert Forum on Users and Producers of Disaster-Related Statistics, which is taking place in Geneva on the 3rd and 4th of September. But it's also appended to the Climate Change Statistics meeting, which is taking place 31st of August to the 2nd of September, also in Geneva. So think about engaging with that and what you can bring from your country and your organisation. Finally, look, it's inevitable that once we have standardized data, what it's going to show us as the best time for action was yesterday, right? But with standardized and validated statistics, what we'll be able to demonstrate to policymakers and the public is that the next best time for action is now. Thank you.
Thank you so much, and for ending those calls to action as well. I'm going to jump on that bandwagon and maybe ask for Gendra to share on this screen the QR code for our platform. Just to let you all know, we're publishing a series of topic documents for each of indicators that have been endorsed by the UN Stats Commission. So far, we've published 2 of the topics, vector-borne diseases and waterborne diseases. And this week, we're publishing temperature-related mortality. So please do have a look at our platform and keep up to date with those upcoming publications. And to encourage you all again at the bottom right-hand screen, please add your questions to Slido. I think we've got a handful to start with. So maybe I'll put a question to each one of you and then you can answer them in turn. So the question to Gendra is, who are the primary users for the SOSCHI framework? And maybe if you can combine that with, does the initiative utilise non-UN statistical tools to provide varied insights? And then 2 questions for you, Professor Tarek. One is, how do these transportability methods differ from existing methods like Bayesian hierarchical modelling or meta prediction models in many of the MCC studies? And then a separate question, is there a way to use remote sensing data to improve localized impact data? And is this something you've explored? So we'll start with those, and to encourage everyone to please add your questions, and we'll try and fit in a second round if we have time. Thank you.
Thank you, Bonnie, and thank you for these questions from our participant. I think this is very important questions because that defines what you and how you develop the framework and the approaches. So when we initiated this work, keep in mind the primary user, and still primary users is the national stat offices or the analysts who work and produce the official statistics on a regular basis. However, over a period of last 3 to 4 years, we also realize this area is a multidisciplinary area. So this is not only restricted to the official or only to the statistics offices, but also overlap between different stakeholders, different research and disciplines. So having that national stat offices or national or official analyst working on the NSOs is a primary users, but also the Ministry of Health and other key users is also kind of a users for these particular initiatives of SOSCHI framework. But also not limited to Ministry of Health and NSOs, but also the research community, because whatever the tool, the methodology, the evidences we are developing, not only in UK, but also in Ghana and Rwanda, also used by the research community, the academics, and also the policy users, as Kansa mentioned in her presentation about all the different stakeholders and disaster-related organizations, etc., who was involved in the. So policy users are also engaged. With respect to the second questions on the non-UN statistical, so I think just to, if I understand the questions correctly, so this framework and based on the SOSCHI framework, we have developed the 3 different type of output or tool which can be used by the users. One is the open source climate and health package, which we recently published in CRAN, where user can actually download the package, use in their day-to-day work on those priority indicator endorsed by the UN. The second mechanism is to directly use our GitHub code, where they can actually integrate the GitHub code in their workflow and use that tool. The third and final one is the platform, where we have the indicator tool where the user can upload the data and use. The SOSCHI framework wants to disseminate the framework via platform, and these are the 3 mechanisms where we are promoting the tool rather than using any readily available non-UN based statistical tool. We have used a lot of available statistical methods from our research and academic community, where we are using and translating into more sort of a reusable format where a user can use that one. So that's the answer to the second questions. Thank you, and I hand over to Tariq for the next 2 questions.
Okay, thank you. Don't know why I'm talking. So we answered the 2 questions. So the first one was a double question about just like comparison with existing techniques. And it's a gradient. So when you think about it, even like very simplistic method like health impact assessment, quantitative risk assessment, when you think about it, this is an implicit transportability exercise when you're going to use existing dose response from systematic meta-analysis or other studies and try to transport this effect estimate to a new context and adapt that to a differential exposure also. So this is a type of transportability, but kind of by accident somehow. And that's the same, I think the question was referring to also the MCC network, which is a seat like one I cited, one of their studies. Actually, there are 2 studies, if I'm correct, that actually that has been labeled as a three-stage modeling. And to me, this is also another type of transportability by accident. But to me, it's a little bit suboptimal because this kind of exercise was focusing on time-fixed kind of effect modifier. And we dig into what it's actually about. Any type of transportability generalizability, it's about heterogeneity in distribution of effect measure modifiers. And the scale would matter and everything, but when you look at what has been done, it's really like, it's kind of in the same grade, like in this kind of gradient of methods, but suboptimal because it's not, there is no optimization process. And it's also focusing on specifically on static effect modifier. So that's in a good direction, but this is like my point is we can actually rely on existing and modern causal inference framework for this kind of transportability technique. I think we can do way better. And there was a question about Bayesian hierarchical framework, which is not compatible. I mean, there are a lot of efforts, and the GBD, global burden of disease, also uses a lot of these techniques to help the prediction. And it's not mutually exclusive because Bayesian hierarchical framework is, and we talked about that this morning, it's really about just like capitalizing on spatial structure, and that will help to use latent spatial information, but also to improve the statistical precision, which is always a good idea. So yeah, it's totally compatible. And the second question was about remote sensing data. And actually, thank you for the, I don't have time to get into that, but I think this is an underused resource for improving spatial, like transportability and relying on spatial effect modifiers, because there is so much information we can rely on with satellite products and satellite images that I think could be super useful. And actually, we are like working with a postdoc in San Francisco about this exact topic, about how we can use like conventional neural network and CNN in context of remote sensing images, and how we can use that for transportability application. So this is something we are actively working on, but that's a bit technical. But thank you for the question, because that's just to say that this is very, very active area of research, and there is a gradient, a spectrum. I think at the end of the day, if we integrate that into a robust causal inference framework, and also with a priority of filling this differential evidence gap, I think this is the way to go. And also not forgetting that it has to be useful and usable, as has been mentioned by the last speaker. This is something to never forget, to deliver, produce data that makes sense, usable, and also connected with our policy and implemented. Otherwise, we're just wasting time, and we can't afford that.
I think that's a perfect place to end. Thank you so much for your time. That the hour has flown by. Thank you to all our speakers and those who joined as well. Great to see the good turnout. If there's anything we've not covered today and you have any questions, please do contact us. Our email is on the screen there. Follow us on LinkedIn as well. And thank you again. Thanks, Professor Tarek, Dr. Kanza, and Dr. Adendra as well. Thank you, everyone.
Thank you.
Have a good rest of the day.